So what is pulmonary embolism? So if you could see my diagram one more, I did two topics on one diagram. So pulmonary embolism, you see that red thing right there? What is that? That is a blood clot right there. Pulmonary embolism, in short, is a blood clot in the lungs that originated from somewhere else. The blood clot did not originate from the lungs, but then from somewhere and then came to the body, to the lungs, sorry, and then it caused that clog over there. The most common cause of pulmonary embolism is DVT. And what is DVT? DVT is deep vein thrombosis. Deep vein thrombosis is a clot that happens in the deep veins. And where can we see some of our deep veins? Did you say in our femoral? Yeah, so our femoral vein. So if you could see this place here, you could see a red thing right here from the thigh going that way. It's a long red line. It goes all the way here, comes down to our ventricles, all the way back to the arteries, and then boom, to the lungs. That is pulmonary embolism. The blood clots originate from somewhere else, not just anywhere, but then our deep vein thrombosis, those are DVT. So this is one of the veins that could a blood clot could generate from and then travel all the way to the lungs. Another vein that has a deep vein could be our words common iliac vein. I believe so. I believe our common iliac vein is going to start from somewhere in our upper body and then travel all the way to our lungs. That could also cause pulmonary embolism. So the most common cause of pulmonary embolism is that one. So now let's look at what could be in danger. That's our lungs. And we know that our lungs is involved in circulation and then gas exchange, ventilation. Now we see this red huge blood clots sitting right in our lungs. Ooh, scary, isn't it? Yep. So now there's going to be gas exchange is going to be impaired, and then circulation is going to impair. So you could think about those symptoms already for pulmonary embolism: difficulty breathing and chest pains and all those stuff. What will be the risk factors? Risk factors for pulmonary embolism is going to be immobility. Like some people literally, like, they don't want to move their body and age. Well, some of them is due to age, is due to sickness. So if you are taking care of a patient in your ward, you have to try to give them some activity. Not activity like, okay, they have to go run a mile on the road or something. No, pace activities for them to keep them moving, to avoid them from being stagnant at one place. And then smoking. Oh well, I guess smoking is going to pass for any major health issues. So I'm not saying smoking is bad. Honestly, I'm not. But I'm trying to say that smoking could pose for a risk factor for any major health issues. And also, other stuff that could cause pulmonary embolism could include um, oral contraceptives. Some oral contraceptive contains both estrogens and progesterones. It could lead to pulmonary embolism. We have pregnancies. I don't have much knowledge about that, but then, yeah, atrial fibrillation, surgery, obesity, lung bone fracture. As I said earlier on, that's what's the common lung bone that in our body system? The femur. So, yep, when you fracture your femur and there is no circulation happening there, blood clot happens, and circulation from that vein goes directly into your lungs. Boom, deposit the clot over there, and then it goes out to walk free. So, as I said, the symptoms of pulmonary embolism. With this sitting here, we are going to have shortness of breath. Yep, we are, because gas exchange is impaired right there. There's going to be chest pain when we try to breathe in. Chest pain. And also, there is going to be anxiety. There's going to be tachycardia. We're going to see tachypnea, hypotension. There's going to be cough and crackles. Yep, crackles, because this is sitting in our lungs. There's going to be diaphoresis. We're going to have restlessness. Labs. Labs. There is a lab called D-dimer, and lab is used to um that lab is used to diagnose pulmonary embolism. It's I They said it's a protein fragment that is in the bloodstream, which is used to measure dissolved blood clots. So yeah, so I only know of one lab so far. That's the D-dimer. Diagnostic testing. CT scan is used to diagnose pulmonary embolism. Now let's look at medications. Let's look at some medications. So some medication that are used to treat pulmonary embolism would be our anticoagulants. So what will be the role of our anticoagulants in this? So what are some of our anticoagulants? Did you say heparin? Yep, you got it if you said heparin. So we have our common ones, the warfarin and heparin. And this class of medication is used to prevent the blood clot, that's the already clotted blood, from getting any bigger. So that means that if this blood care is not taken, it will grow and then cover your whole lungs. Trust me, this condition right here is a life threatening, because seeing a clot of blood in the lungs, I don't know what else could go worse. And also, this medication can be used to prevent the formation of new clots. Another class of medication here is going to be our thrombolytics. And what are some of our thrombolytics? Our thrombolytics are going to include those drugs that ends with in ASE. So we're going to see our streptokinase, we're going to see our place, something like that, whatever. So the action of that medication is that it's going to break up the already formed clot. So when it's administered, boom, it will break it up. So it's going to let it dissolve. And in worst case scenario, surgery is done, and this surgery is called thrombectomy. Why is this surgery done? This surgery is done to remove the cloth if needed, or it is done to place a vena cava filter. I don't know where that is placed. Maybe is it your superior or your inferior vena cava? I have to find out that. And it's placed in your vena cava to catch the blood clots before it reaches your lungs. So before it travels through all those places to get your lungs, there will be maybe your inferior vena cava, That should be somewhere in your venous system. Yep, on your right side of the heart. And then that is going to catch the blood clot before it gets to your lungs. Now, let's look at some cautions or considerations to look at when someone is in this condition and they are on those anticoagulants and thrombolytics. So first of all, they're having breathing issues right here. So you're going to try and sit them up. So try and raise the head of their bed so that they could have easy breathing. Administer oxygen if it is ordered. You start them on heparin. Why? Heparin is our fast, rapid acting anticoagulant, just like our albuterol was for our asthma patient, like our bronchodilator. We know that albuterol was our short, fast acting. So over here in our anticoagulant, heparin is our fast acting. So you administer that first to get the effect that you want, and after that, you're going to do the warfarin, which it's slow and like our corticosteroids, and it's going to take days before you get that therapeutic effect. So how do we measure the therapeutic effect of warfarin administration? We're going to measure that by checking the patient's PT. I don't know what that PT means. And INR levels. I think the INR is it international normalized ratio, something like that. So a therapeutic effect is between 2 and 3. That is considered normal. You have to caution your patients that they should try as much as they can to um, avoid things that will cause bleeding. So, what are some of the things that you caution them about? You tell them to fall precaution. So, you have to put a fall precaution by their door, by their bedside, and all those stuffs going on there. And also, you're going to they should try and use soft toothbrush to avoid gum bleeding. They should avoid aspirin. Aspirin, side effects of aspirin, bleeding. So they should avoid aspirin. And you should also educate your patient to maintain consistent vitamin K levels. Why do we talk about the importance of maintaining consistent vitamin K? Because vitamin K is directly involved in the regulation of blood clotting. So if there is a sudden increase or a sudden decrease in the vitamin K levels, it's going to lead to maybe bleeding or clot formation. And also consistent vitamin K levels help with the effectiveness of the medication that your patient is taking. A few more things here is going to be that they should try and use electric razor instead of the normal razor. They should not forcefully blow out their nose, like when they feel that dryness in their nose. Just let it be. Just don't stress it. Nursing care in deep vein thrombosis. Smoke cessation, please tell your patients. Patients should also increase their mobility. You're going to provide a compression socks to your patient to help prevent the formation of blood clots. Oh my goodness. I hope you all enjoyed this, and sorry I could not cover the medications and the pulmonary edema. So I'm going to do a different thing on the pulmonary edema we're going to do a review on perfusion and cardiac function. So leave your comments and your questions that you have for me, and I will answer. Thank you.